All right, our next presentation is going to be Opportunities for Physicians in Medical Communications and Advertising, and we're very, very pleased to have Dr. Dana Carpenter as our presenter. Dr. Carpenter is currently Medical Strategy Development Director at IPG Health. She previously served as a Senior Vice President, Medical Director, and a key member of the leadership team for the Medical and Scientific Affairs Division of CDM New York, a leading healthcare advertising and medcoms agency where she developed medical and scientific content and provided important strategic direction to numerous pharma brands. As an obstetrician gynecologist, Dr. Carpenter lends her clinical experience and expertise to many women's health brands. However, her marketing experience spans a number of therapeutic areas. Prior to her transition from medicine to marketing in 2009, Dr. Carpenter was a lead physician in a thriving OBGYN practice for nearly 10 years. She's a native of Chicago. She earned her undergraduate degree from the University of Illinois at Urbana-Champaign and her MD from Rush Medical College at Rush University Medical Center in Chicago. Welcome back, Dr. Carpenter. I'm looking forward to this.
Thank you. And good morning, everyone. I'm so glad to be here. Like Jim said, I'm Dr. Dana Carpenter, and I'm super excited to talk to you about the world of medical communications and pharmaceutical advertising. Over the next 45-ish minutes, I really hope to give you a terrific sense of really what this industry is all about and why I think it's a great non-clinical career option for some of you. In this time, we'll talk about the agencies, the clients, what you can expect should you land in this industry, and just a little bit around how to find a job in this industry, because that can feel a little bit daunting for those of us leaving the bedside. But first, I really wanted to start by having you think about the times when, let's say, reps show up at your office. Did you ever wonder when a sales rep shows up at your office and hands you something to leave behind? It's a brochure. It's a large leave behind that talks about their drug. They might be showing you something like this, an iPad detail that's got some really important data that they're trying to share, some really interesting graphics. Do you ever wonder who created that? How did the rep get those materials to leave with you? Or let's say you go to a dinner program, right? There's a speaker program in the evening. It's put on by a pharmaceutical company. They're teaching you all about a disease state and a drug that's coming to market that's very important, and you're learning all the high science behind it. Who created that presentation? Did you ever wonder? What about if you're at a conference, right? And you go to the booth and the sales reps are there, and you see all kinds of really interesting, engaging things on the wall. And you see this really cool MOA video. And this in particular is in the renal space and the nephrology space. And it's all about a V2 receptor antagonist. Like, who created these visuals? Like, someone had to do this and figure out that these are, renal cells, and this is the antibody. Who created that? Did you ever wonder? Or this is a fun one. This is a game that was created for a conference for the American College of OBGYN. And these are OBGYNs competing against each other in a fun game. While they're playing the game, they're actually learning sort of the secret struggles of women who have abnormal uterine bleeding because of fibroids. But you can see here on the right, for the winner, she gets all kinds of really interesting facts that could be practice changing for her. So we call that edutainment. The short, or I guess what I really want to know is, did you ever wonder? I certainly wondered when I was in practice, who creates all this stuff? Where'd it come from? The cool thing is, not only is it agencies that partner with pharmaceutical companies to create it, but physicians like you get to participate in the creation of these materials. So it's really a fascinating industry to join. I was certainly one of those physicians during my career. But as Jim said, I started as an OBGYN by training and practice, did that for about 10 years. And then, believe it or not, it was 20 years ago, which is hard to believe. I left the bedside based on a call from a random recruiter. And I'll tell you later in the presentation how that recruiter discovered me. But I fell in love with this industry. I moved out to New York City and spent over 10 years in my career in medical communications. And it was awesome. So I'm excited to tell you more about it. Like Jim also said, now we do something a little different. Since the pandemic, I'm not client facing anymore, but I am training junior medical people who come into the industry. So physicians like you who might join our industry new, and helping them understand what the industry is about, what the work is, and help them really get a good foundation under them so that they have a successful career. And then, of course, I help them develop their career. So it's a really cool opportunity to help sort of my fellow physicians and maybe some PharmDs and PhDs thrive in this industry. But that is way too much about me. Let's talk about why we're really here, which is, where does all this marketing magic happen? Medical communications is kind of a broad term that covers three sort of kinds of agencies. I came from the marketing and advertising side of the business, and there we work with pharmaceutical company medical marketers. So they have a marketing division, and those are who our clients are. And the goal is to create materials to communicate out to healthcare professionals, not for patients. We don't need a lot of medical involved in the creation of material for patients, but for physicians, any information that a drug rep delivers to you, you see at a conference, that you see online, that is sent to you from a pharma company, all of that information is created by an agency. So those are the marketing and advertising agencies. Then there's the promo med ed agencies. So what's interesting about them is, while they're still very brand specific in the materials that they share out to physicians, the goal for them is to partner with the medical affairs team in a pharma company. And in partnering with medical affairs, what they do is they create peer-to-peer communications. So communications that a medical and scientific liaison or a key opinion leader will share out at a conference, for example, with other HCPs. Highly, highly scientific, always about a brand, but it is never to sell a drug. It is not about promoting. It's just about informing. Whereas marketing is actually about promoting. We're also informing, but we're always also promoting. On the publication planning side of things, I call that the driest side of the business, if you will. It is the most highly scientific, and we'll talk in more detail toward the end of the presentation about that. But medical affairs departments are also the clients for publication planners. And the reason it's the most highly scientific is because you can see here, they're creating materials truly for peer-reviewed journals. So it's the abstracts, the posters that you see at congresses, and then of course articles. And again, we'll hit on that a little bit more later. But no matter which side of the industry you're on, your clients will be pharma, biotech, or device companies. This is just a smattering of them. They come in all shapes and sizes, but pharma will be your clients. So if you hear pharma and you think Snidely Whiplash, the little, evil guy with the lady on the train tracks, and I know I'm dating myself, medical communications is probably not the non-clinical career for you. But if you think pharma and think they can do great things for the world, this could be a great non-clinical career option for you. So let's dive deeper first into the world that I know the most about, marketing and advertising. So look, a career in marketing and advertising for physicians is great for a number of different reasons. One is that you get to stay abreast of all the latest news, the latest advances in whatever therapeutic area you're working in. So, right, because the new drugs are the science of yesterday, and the science of the future. So you are a part of cutting edge medicine, which is super cool. You get to, if you think about it this way, you get to bring medicine to millions, right? The information that you're creating with a team of people is shared out to physicians, which is shared out to millions of patients. So you're making an incredible impact. And one of the best things I thought was the growth and the learning that's involved. So, for example, I was an OBGYN. I often worked in women's health brands, but I also worked in cardiology, oncology, nephrology, endocrinology. Like, you will go outside your field of expertise and broaden your therapeutic area expertise enormously. And so the learning is amazing every single day. It's awesome. And you get to just create really compelling, cool materials like we already talked about, the iPad presentations, the MOA videos, the edutainment, that sort of thing. But we do not do it by ourselves by any stretch of the imagination. We are just part of a team. It really does take quite a village to create all these materials and get them out into the universe with these pharma companies. So let's talk about that team for a sec. The account team, they're the people who run the business, right? They manage the client relationships and they keep everybody on track. The copy and art people, they are creative, and collectively they truly make sure that the materials are the most visually and from a text perspective, engaging and compelling. There's a whole department of strategists who really think about what motivates physicians to prescribe a particular drug. Why do physicians behave the way they behave? And then they sort of strategize based on any given brand and therapeutic area, how to maybe alter their prescribing habits based on whatever it is the drug they're trying to promote. And then medical gets to work with the whole team. And by medical, I mean MDs like you, but also PharmDs and PhDs. So you'll work side by side with pharmacists and scientists, and you will dive deep into the disease state, the data, the MOA, everything about the brand scientifically. And you will get to think strategically as well about how your brands are going to be communicated out into the world. But you can see here, collaboration is the key to success. Without one little cog in this wheel, it all kind of falls apart. So you really have to be on board with collaboration when you join an agency. And I think I already kind of touched on the fact that, we cross a vast amount of therapeutic areas. You can work on like cutting edge stuff, right? In cardiology, when PCSK9s hadn't even hit the market, we knew all about them, right? Because we were going to be promoting them. So we learn in advance of everybody else. Antibody drug conjugates, the evolution of their use in oncology is groundbreaking. And agencies are in on the beginning because pharmaceutical companies engage us really early, like in their phase 2 trials. And so, we're in the thick of the science long before the science really gets out into the universe. And then, of course, how can you not talk about GLP-1s, right? The revolutionary metabolic health kind of craze that's out there now. Agencies have been at the forefront of communicating that out to physicians and why these GLP-1s are so important for certain patients. The work that we do, though, it's not just diverse, it's meaningful. Like I said before, you in our practices, we had our, panel of patients and we saw those patients, and that was incredibly important. In this industry, the way we look at it is we're communicating important information out to thousands, if not millions of physicians, and then that's getting communicated out to millions of patients in the form of prescriptions, and you're impacting their health, the health of millions of patients, right? So it can be really meaningful and broad reaching, whether it's primary care or rare disease. It doesn't matter the number of patients, like we're really making an impact. And I want to tell you a little bit more about these specifically, sort of from a case study perspective. So in the primary care space, everyone, of course, has heard about Lipitor. So Pfizer launched Lipitor in the mid-90s. And what's interesting about that launch and the way that Pfizer partnered with their agency at the time is that Lipitor, despite being the eventual market leader, they launched into a very crowded space. They were not the first to market. And so it was kind of a snooze fest. Not only were they launching into a crowded market, they were launching into a crowded market that was filled with M&M data. Morbidity and mortality was all that was being talked about at the time. Lipitor didn't even have M&M data. What they did have was cholesterol lowering numbers. And so the agency and Pfizer decided that is going to be where they really put all their eggs. That's the basket they're going to put all their eggs in, right? Is number lowering. And that's what they did. And today we still talk about our cholesterol numbers and which ones need to be lower and which ones need to be higher. And that is all because Lipitor, Pfizer, and their agency changed the way that we perceived the market. The other thing that Lipitor did, which I think is super interesting in this middle visual, is that when they evolved their campaign, they did it based on some market research with physicians and patients. And what they discovered is people really had an emotional connection to Lipitor. They loved their Lipitor. So they used the Lipitor symbol, the rings interchanged, like a heart, right? So this gentleman who's on Lipitor, excuse me, he hearts his daughter, or he Lipitors his daughter, right? He loves Lipitor because he's here for his daughter because of that. And so they were still focused on the number lowering, but they brought emotion into this space for the first time. And that really resonated with physicians and with patients. So this was all marketing magic, right? Because it's hard to envision bringing a drug to market where M&M data is the table stakes, and you don't even have M&M data yet. They not only did it, but they became obviously the market leader that everybody knows and loves today. Another interesting case study is with Bayer. So for those of you familiar with Bayer, they have had the Mirena IUD on the market for, oh my gosh, I don't know, 30 more years. And it's a 5-year IUD for women who've already had children and are done having their families. And that is how OBGYNs were trained. And then Bayer developed a different IUD. It was smaller, easier to insert, and it only lasted 3 years. And they wanted to target young women. It was sort of hard for everyone to wrap their head around when knowing that OBGYNs only think of IUDs for Paris women who are done having babies. So again, the impact of marketing is amazing because we created these campaigns where you can see who the patient is, right? She's a young woman. She hasn't had a family yet. And the reason that she should have this IUD. The woman on the left deserves this small 3-year IUD because she's still in school and she wants to finish her studies. Or the woman on the right has this burgeoning architecture career. So she wants a 3-year IUD till she can get that career underway. This was really a super impactful campaign. And again, it was the partnership between pharma and the agency that created this. And you really, if you're lucky, will get an opportunity in this industry to, if not change or transform a therapeutic category, but maybe even create one. And that's what Pfizer did with Viagra. When in the 80s and early 90s, impotence is the word that everyone used for this problem. And men's health wasn't even a category, if you will, right? Nobody wanted to talk about impotence. It was taboo and embarrassing for everyone, physicians, patients alike. But Pfizer had this drug that they knew could help men. So what did they do? Their agency created the term erectile dysfunction. They clinicalized something that men were suffering with and brought it to the masses. And the masses, as you know, embraced it. And they created that category. It didn't exist before the agency brought it to life with Pfizer. And so these are some of the campaigns here. And I think we can all agree that the cultural and clinical shift of Viagra has been seismic in men's health for sure. So this was very important marketing. And we can still feel that today for sure. The other thing that I wish for everyone who gets an opportunity to work in MedComs is the ability to touch a rare disease brand. So rare diseases, because they're rare, they impact a very small often group of patients. And because of that, congresses, for example, are so small that scientists, clinicians, caregivers, and patients are all attending the conference, which is pretty unusual. It's not at all that way in larger categories. And what's really great is you get to know the patients and the caregivers and the clinicians and even the scientists who are behind the scenes, of course, developing new therapies for these rare diseases. And you get a chance to, even during photo shoots, invite patients like Sophia and Lauren to be in the communications out to physicians, which is super impactful. Number one, when you can actually see a patient who's having success on a brand, but it's cool that you get to actually witness over the span of time on a brand. You know, you might be on a brand for 7 years and you can see the therapy work for these patients. And that's really not the case in most therapeutic areas. So rare disease is really transformational and gives marketing really a whole lot of meaning, I think. Okay, so hopefully you get a sense of all kinds of exciting things that we do on the marketing side of things. But what can you expect when you even, think about a career in this industry? Well, first of all, there's a very long runway. So the career ladder, if you will, that exists in this industry is very tall, and you can climb it very quickly and efficiently, if you will. Most physicians bring, of course, lots of clinical expertise and experience. What they're missing naturally is marketing and strategy, right? Those are, things that we just don't do a lot of in medicine. And so even though you think you might want to enter on the right-hand side of this arrow, at the VP level, you may end up closer to the other end of the arrow, more the earlier part of the career. Again, because you'll need to learn marketing skills and strategic thinking. But climbing this ladder can happen, again, very efficiently. And there are lots of stepping stones along the way and just unimaginable growth. So there's definitely a career, a lovely career that awaits you, and a career that lets you still use your clinical knowledge. So for all those people who say to you, oh no, you're wasting your degree, you won't be wasting your degree. I promise you. Everything you learned clinically in medical school, residency, and in your practice will be applicable in some way, given any of these roles that you might be playing in your industry job, right? So you might be serving as an expert one day on a specific topic and teaching all the other people on your team about the science, or you're, digging deep, doing research on a new therapeutic area that's completely new to you, right? So you're really diving deep there. You might be strategizing about a particular brand, like all the things that you do in those roles are going to benefit from all of your clinical knowledge and experience. Or any contribution you make to, let's say, an MOA video, like you get the opportunity to say what, that renal tubule cell looks like, and what that antibody should look like, and what that virus should look like, right? Like you get to rely on all of your clinical experience and expertise and learnings from your schooling days. And then you get all kinds of cool opportunities as well to attend conferences differently. You don't have to attend just to learn. You get to learn, but also put on your marketing hat and think about your drug, where it fits into the space, and talk to people about that. You get to brainstorm and talk to KOLs, key opinion leaders. It's really, it's a terrific opportunity to, take everything that you've learned and just build upon it. And not only, excuse me, do you have clinical knowledge, but look, you have all these other skills and abilities to bring to the table, right? So let's not forget, you communicate on a daily basis with patients, with medical colleagues, whether they're within your specialty or outside of your specialty. I know you know how to communicate, and you bring those skills to the industry. And you have some natural abilities that we already touched on a little bit, because we've all gone through residency, so we've all taught someone something along the way, right? We teach our patients as well. So you have the ability to teach and distill really complex scientific information into very digestible bits of information. And that's super, super important in this industry. And then, of course, you're passionate about growing and learning and functioning as a team. So bringing all of that to the industry will definitely help you be successful. And as you enter the industry, think about it for just a minute. You are literally the audience for which agencies in marketing and advertising are creating materials, right? These materials are for the healthcare professionals out in the world, and you are that healthcare professional. So who better to help create those materials than somebody like yourself, right? So you're bringing a lot to the table. So keep that in the back of your mind as you kind of begin to think about this as a non-clinical career path for yourself. When you do land an industry job, and we'll talk about how to do that toward the end, you're not gonna be in a hospital, you're not gonna be in an office, you're gonna be in a corporate environment. Whether it's remote or not, it's still very corporate. So just know that that is the case, and what comes with that are some really great things, like pretty regular hours. Um, we're mostly 9 to 5. We're kind of the banker hours. That's not the case for all of the disciplines within an agency, but medical, by and large, is roughly 9 to 5, 10 to 6. Like, you kind of set your own hours, whatever works for you and your brands. If you're on a new business pitch, it can get fast and furious and really, really busy with tight timelines. So sometimes we would be in one day for a couple of hours on the weekend, just to rehearse. Or you might be there late at night helping the creatives make sure that all of the imagery in the pitch deck is just perfect for the client. Or if you're on a brand launch, right, you have a drug that's just going to market soon. Also, you could be a little bit busy. But beyond those two um, sort of extremes, everything in between is kind of 9 to 5, which is great. After the pandemic, everyone, obviously, or during the pandemic, everyone went remote, and they're pretty much still remote. So what's good about that is a couple things. Most importantly, it is so much easier to get a job now. Before, we all had to uproot ourselves and move to mostly New York. Most of the agencies are there in that area because um, most of the pharmaceutical agency or companies are there. There are some across the country, but by and large, it's centered there. So you don't have to do that anymore. Most agencies are fully remote, if not partially remote. There are a handful of agencies that ask you to be back in the office a few days a week, but those are few and far between still today. The other thing is, when I worked in the industry, 5 years ago, pre-pandemic, remote was so difficult. You were just a little voice on a conference machine in the middle of the table. And now we are fully functioning with Miro boards and, Zoom calls like this. So it's so much easier to do your work and still collaborate remotely. If, though, you do show up in an office, what you should know is that you're going to walk into an open office space. There are a handful of offices here and there, but mostly everybody's at a 6 foot, desk, where they can work today, but at a different desk tomorrow. So it's this kind of hoteling mentality, if you will, that's so common in the corporate world today. And honestly, in our industry, to have that kind of energy and collaboration out in the open as opposed to in individual offices makes a lot more sense. Finally, lots of paid time off. We do get many, 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 many holidays, far more holidays than I've ever had in my life. Lots of vacation, paid sick, all of that. I mean, 30 plus probably days a year. To be honest, IPG Health, where I work, we have unlimited days off, as long as we get our work done, obviously. But what's really cool are bullets 2 and 3. The week between Christmas and New Year's, every year pharmaceutical companies close, and so do we. And that's just paid time off. That doesn't count towards any kind of vacation tallies. And then in the summers, most agencies have have a half day on Friday, so we get slightly longer summer weekends. So those are just a few of the corporate benefits. I'm sure you can tell I'm pretty stoked about this industry. I really think it's fab, and there's lots to love and not love. So let's talk about that for just a second. It is obviously fast-paced, high energy, with people that are really passionate about making sure the right patients get the right drugs for whatever disease. But everyone wants to learn and teach. There's great work-life balance, like I was just saying. You get to collaborate. The clients your relationship with the clients can be really terrific. We've already talked about how you can feel really make a difference across millions of patients' lives. Another interesting thing is in this corporate environment, there's often a lot of philanthropy that happens. And so you can get involved in that. For example, my agency, back when I was in the industry, we did a fundraiser every year for the American Heart Association. We took the entire month of February to raise awareness, excuse me, within the agency and obviously funds for the American Heart Association on behalf of the Go Red for Women campaign. And as OBGYN, I stepped up and ran this month-long campaign for 10 years, and we raised thousands and thousands and thousands of dollars for the American Heart Association. So everyone, all the agencies have lots of philanthropies that they work for and with. So you'll have that opportunity as well. So lots to love, a handful of things you should know that aren't, the best, but they're certainly not deal breakers. The first and foremost, medical does not run the show. So if you're used to being a surgeon running your own OR or just a physician running your own office, that's not going to be the case here. As I showed you on that schematic earlier, physicians are part of the team and we all do this together. We are not running the shows. You have to be comfortable with that. There are occasionally demanding clients, setting tight timelines. That's not always fun, but it doesn't happen very often. And honestly, it's the account team's job to manage the clients away from that kind of behavior and setting tight timelines. But when it does happen, we always step up. And then there are these tiny little tedious tasks that sometimes just have to be done. Annotating pieces, for example, making sure that everything that leaves the agency and goes to the pharmaceutical company to go out into the world is 100% accurate, right? And so medical plays a pretty vital role in that, which can be a little bit tedious, but it is a pretty minor part of our job because we have editors to help us with that. So lots to love, a tiny bit to, just be aware of. All this time, I'm sure this has been on your mind. Can you even make a living at this? And the answer is 100%. You certainly can. You will definitely be in the six-figure range. That where you start will just kind of depend on the agency. You may start at the lower end of six figures. You may start, in the 150 in that middle range, but you'll definitely be in six figures. And the good news is, as you get into the VP and SVP level, your salary really begins approaching and exceeding 200K. So there's ample opportunity to make a good living in this industry. The other thing is, for those of you in particular who feel like that's going to be quite a pay cut for me, just keep in mind, you don't have to round anymore. You don't have to take call anymore. You don't, have to cover the ER. You never have to hear the answering service again say, "Hi, Dr. Carpenter. This is the answering service. I have such and such a patient on the line for you." You don't have to hear that anymore. And then, of course, the risk. All of that goes away when you're in this corporate environment. So for me, the trade-off was 100% worth it. Obviously, that's a very personal decision for everyone as they think about this as a viable non-clinical career for themselves. So just as a quick wrap up before we move on to the pub planning and promo med ed, medical marketing, pharmaceutical advertising, yeah, I think you get the gist, right? It's exciting. You get to apply your degree and your experience and your expertise every single day. You're on the cutting edge of medicine. You get to use all your communication skills and you get to teach and you get to learn every day. You will grow in unimaginable ways. And truly, your work will have ripple effects out into the world for years to come. So it's really a pretty rewarding and exciting space to work in. But it's not for everybody, right? Some people just, even hearing marketing and advertising just doesn't feel good to them. And that's cool. You still have other options. Promo med ed and pub planning. So we talked about these just briefly earlier. Starting with promo med ed. So their clients are not the marketers at the pharmaceutical agencies. They are the medical affairs teams. And they partner with them to arm medical and scientific liaisons, and KOLs and other physician speakers with all of the right information about disease states and drugs to communicate out to physicians. So there are no sales reps involved because there's no selling of a drug here. It is simply information for information's sake. It's all the same information, just minus the marketing spin on it. So the material feels even more scientific and more clinical when you're in the promo med ed space. Another really cool thing is that you get to not just interact now and again with KOLs, which we do on the marketing side. You get to know the KOLs in your space, in promo med ed, and you really, when you see them at a conference, you can have a conversation with them. They will know you. Like it's a really fun space to be if that kind of thing appeals to you. So we call this peer-to-peer information exchange, right? So if creating materials, not for sales reps or drug reps, but for MSLs and KOLs, if that feels more aligned with what you're thinking works for you, promo med ed agencies are really where you want to steer your career, or at least your research about this career. And then if you're even, I'm going to say even more high science, think about pub planning. So those agencies, again, they partner with medical affairs, but now they're creating the abstracts and the posters that you see at congresses. So anytime you've stood around a pharmaceutical sponsored poster and heard the poster presentation at a conference, that poster was created by an agency in partnership with their pharma client. But that's not all they do. They truly work with the investigators on the studies, as authors to write the journal articles that go into the peer-reviewed publications. And probably the best part of all is that they really get to think strategically about which articles are going to be published in which journals, which conference they're going to roll out that data for the first time in advance of the publication release, which of all the investigators on the trial should be the lead author or authors, what data even should make it into that publication, right? Not all the data goes into the publication. So like which data should be in there, or what are we going to publish next, right? If now we're just publishing the main set of phase 3 data, are we going to have a subgroup analysis that we put out? Or are we gonna be a part of review articles, right? So you really get to think like what makes sense over the course of any given year for a pharmaceutical company as they put out their publications on their different trials. So if really thinking in that way appeals to you, really thinking about highly scientific literature and your contribution to it, then publication planning would really be a terrific avenue for you. No matter what, though, pub planning, promo med ed, or marketing, finding a career in this industry is all kind of the same because all of these agencies fall under these holding companies. And I know you're all leaning into the screen and squinting, but you don't need to because this URL at the bottom, just go to that URL. You can find this online. It is by far the most up-to-date visual that I could get my hands on, and it is pretty current. Then you can blow it up for yourself and really get a look at it. And the point for today is not looking at the details. It's to know that there are about, running down the middle here, there are about 6 different holding companies under which above and below here are agencies. There might be media agencies and PR agencies and patient agencies, which we're not obviously focused on, but you can also find pub planning, promo med ed, and marketing agencies here. So, for example, I work for IPG. So you go to IPG's website if you're going to start some research, and you can see all their different agencies, and you can click on them and learn what they do and find those that feel right for you. Same with all of these, Omnicom, WPP, all of these agencies are discoverable online, and their websites are very built out. And they also have career pages. So it's a great place to look for careers, but we'll talk about that in a sec. So lots of agencies from which to choose. But sometimes just getting into the door can be tricky, particularly for a full-time job. So a lot of physicians and a lot of people in general even outside of the medical space in our industry, do freelance work first. So independently contract with any number of agencies to do work that can range from sort of being a consultant. So they might come to you, they're working on a MOA video, and they want to make sure that the graphics that they're creating make sense to you as a physician, right? So you might just be a consultant, and they come to you now and again for some like thumbs up or thumbs down or some advice. Or you could be truly embedded into a brand where you are in the day-to-day work with everybody as the lead medical person on that brand. So the work will vary in freelance, and the great news is you get to choose, pick and choose what you want to do and when you want to do it. So freelance is a great way to get started in the industry. And these resources right here, Breaking into Health Writing, Ultimate Guide to Becoming a Medical Writer, and Ultimate Guide to Finding a Freelance Medical Writing Job are online resources that you should definitely go and check out. These are the companies under which they fall: RX Communications, American Medical Writers Association, and Health Writer Hub. Check those out. They really will give you a tremendous amount of guidance if you're thinking about freelance. When I have conversations with people who want to get into this career, they often ask, should they get, certified in something? And the answer is, look, it can't hurt. It might help, but it is not necessary. I don't have a certification. Most of the people that I know in this industry, and that's a lot, don't have a certification. That said, can't hurt, might help. Joining the American Medical Writers Association is a great idea, especially if you're still practicing and just thinking this might be an avenue for you. Go ahead and, join up. It will give you a place to network, and it will definitely give you a place to get certifications like Essential Skills and Medical Writers certification. So, those, they certainly can help you get a foot in the door for sure, especially when you don't have any portfolio of sorts. Other organizations to join, you can see here on the right. I would highly recommend joining all of them, if for nothing else, for networking opportunities. And look, it's important not just to network, but make sure that you get noticed, right? You need to be discoverable out in the world, and you need to be informed. And by all of that, I mean, create an online presence for yourself, not to promote yourself, but to share, to show the world that you know how to share medical information, some sort of health information needs to be out in the world, whether it's in the form of a website or a blog or a podcast, whatever. Put information out there. And the reason that I say that is I had a women's health website of my own, and it was just communicating out to patients. I had embedded in there, I had a podcast for pregnant women called A Minute for Moms, and I had a gynecology blog that was kind of funny. And a random recruiter in this industry saw that online, and I was discovered, and the rest is history. If I didn't have that, they would have had no way to find me, because I'm not, I was just a clinician in a private practice. So be discoverable and share out information that feels authentic to you, but also, does good in the world, right? It shares some expertise that someone can benefit from. Then, as I already said, network online, network in person. If you join those organizations, they do have conferences. Try and attend those conferences if you can, and meet people, shake their hands, talk to them about their career. But go on LinkedIn and connect with as many people as you can. So first of all, you could find a company like IPG, and you can search people and find who their HR reps are, connect with them. Connect with people, medical people in those agencies that have jobs that are either early in the career, so you can understand how they made the transition from their previous career, whether it was a clinician or a pharmacist, into the industry. How has the transition been? Or connect with someone more senior and ask them what their career path has been like. So people are very generous with their time if you, really ask them politely and respectfully on LinkedIn. So definitely, if you're not active on LinkedIn, be active on LinkedIn. That's another place where you can have an online presence. Recruiters are on LinkedIn every day, almost 24 hours a day. I know firsthand that is what recruiters do. scour not just the internet, but LinkedIn in particular. So be on LinkedIn and post there as well if you can. Join the Dropout Club. The Dropout Club is a bunch of us who've dropped out. We've all left the bedside. And so you have a plethora of physicians who have come from all kinds of different clinical backgrounds and are doing something different now, something non-clinical. So connect with them. There's actually even non-clinical career Facebook pages. John Jerica, Heather Fork are other people to check out who really help promote. They are physicians and they help other physicians kind of get into the breadth of different non-clinical careers that exist out there. And finally, stay informed about this industry. So MM&M stands for medical media and marketing. So it is an industry rag, if you will, online, along with Pharma Voice, PM360. Those are all industry information sort of publications online that you can subscribe to. I highly recommend that you do that because when you're networking, it can just feel like a Q&A session rather than a conversation if you just come with a list of questions. But if you actually say, hey, you know what I saw on MM&M? I saw your agency, what it won this, agency of the year, right? Tell me about that, right? Then you look smart, right? You look well informed. So you'll also see what agencies, are doing what and who's moving around. It's a small industry, believe it or not. So I highly recommend that you do it because you really want to look informed, not just from a networking perspective, but also when you land that interview. Again, you want it to feel like you already have done your due diligence and you know what you're getting into. And so when you land that interview, not just do you want to sound smart, but you really want to figure out how do you even land it, right? So whether freelance or full-time, LinkedIn, we already talked about, agency website, career pages, we already talked about, they all have a career page. Definitely go there. Industry recruiters are your best friend for sure. So you can find them on LinkedIn, you can Google them, you can just type in medical communications recruiters, and I promise you, you will find a host of them. Connect with them all, talk to them all until you find those that really kind of have access to the jobs that feel right for you. Not everybody does the medical roles within an agency. Some just focus on the creative. So you'll want somebody who's really focused on medical. But anyway, industry recruiters really are key to getting into the industry. We already talked about the Dropout Club, physician side gigs. For those of you thinking about freelance while you're still working, check out physician side gigs because you can actually find freelance opportunities there. So I think we're at the end of our time here, and I hope now you not only get a sense of what's possible in MedComs, but that there are a bunch of resources to help you find your way to MedComs if that really interests you. So you'll have this presentation to review. Hopefully you'll get a chance to check out some of those resources as you give some more thought to this non-clinical career. And at the end, if you have any other questions and you want to reach out to me, please don't hesitate. My contact information is here. I'm always happy to talk about the industry. As you can tell, I have a lot of passion for it. But for now, I'm just going to wish you a whole lot of luck as you search for that non-clinical career that's just perfect for you. And I hope to see you in the MedComs industry one day.
Dr. Carpenter, fantastic. You make my job so easy. I had a bunch of questions to ask. They were almost all crossed out because you already answered them. So
Oh, sorry.
you absolutely, I give you 105 out of 100. Are boards or a license required for these roles?
No, not in any way. That's the beautiful thing. So I was at CDM New York for my career of over 10 years, and we had physicians. So there were physicians like myself that had practiced and were board certified. There are physicians who didn't even finish residency, like they just did their first year and they thought, oh, this isn't for me. We had some who'd finished fellowship, but then came straight into this, and some that just finished medical school and thought, nah, I don't want to practice. So you definitely don't, as long as you have finished medical school, you're good.
And any physicians from overseas that didn't want to go through the whole rigmarole of getting licensed
Totally.
here?
Totally fine.
So medical science liaison,
Mhm.
somewhat related to what you do, at least somewhat in terms of communicating information. Can
Mhm.
that be a career path to do that first and then to go into medcoms? Have you seen that?
I've seen it more in the other direction. MSL jobs are tough to come by. Um, so I have seen more people use agencies as a springboard to pharma, whether it's MSL or Med Affairs, for sure. But you could do it in reverse, if you're lucky enough to land an MSL role, for sure.
And what would how would you evaluate or articulate the intellectual stimulation you had as a practicing obstetrician gynecologist versus what you have now in your career in medcoms?
It's a great question. And honestly, I should go to the question slide. Um, honestly, there's way more stimulation in this industry. I know that sounds strange, but think about it this way. As an OBGYN, I had this core knowledge base and these core skills, and I used them every day for sure. But when I came to MedComs, what I found is I got to use those, that knowledge when I was on women's health brands. But when I was on any other brand in any other therapeutic area, I had to learn it all, right? So it's just, again, I said it earlier, it is the amount of growth and learning that you experience on a day-to-day basis is unimaginable because it'll dredge up things that you like vaguely remember from medical school and you really learn now because you have to learn it, right? Because it's your brand. Or you're just learning brand new things that didn't even exist when you were in medical school, if you're as old as me. So I would say hands down, uh, intellectual stimulation is actually much higher here.
So I want to talk about freelancing just a little bit. Have you seen people as they get more advanced in their career that they don't want to work as much, but they don't want to retire, and so they leave the full-time medcoms injury and industry and and kind of have a semi-retirement doing freelance work?
Yes, that's less likely on the marketing side of things, um, than it is maybe in the promo med ed side of things, only because, um, marketing, involves, I mean, they all involve teams. I'm just trying to think. We don't have a lot of retired freelancers. They are typically like in the prime of their career. I think there are a lot of freelance writing options for physicians who are wanting to retire or slow down their practice. And that's why I would steer you to that physician side gigs website, because not only will they point you to industry if industry makes sense, but they will point you to a lot of other places where there's writing outside of agencies for sure.
And ballpark on the range that you could expect for freelance writing assignments,
You know what?
compensation.
I don't know the answer to that. Sorry.
Fair enough, no worries.
Yeah.
And last question I have for you, is moonlighting in a clinical role or other roles allowed or encouraged? Say you want to pull a shift on an ER on a
Mhm.
Saturday, or you have all this time off that week between Christmas and New Year's, you want to go do locums. Is that the type of thing that people do
Oh,
and stuff like that?
I don't know anyone who does because most people just kind of want to, leave the bedside and never look back. That said, it would be tricky to do locums at night for sure, to do like moonlighting, sorry, at night.
Yeah.
If you were going to just take that week of Christmas though and go do a 1 week locum assignment, like absolutely that there would be no issue with that.
Thank you very much, Dr. Carpenter. Fantastic. Thanks so much for
Good.
coming back.
My pleasure. Thanks for having me.